So we're going to do a knee evaluation for you. So first I'm going to start with a few questions that I have you answer. So are you weight bearing or non-weight bearing on this knee?
Non-weight bearing.
Okay. When did you first notice these symptoms?
About a year ago.
Okay. And have you had any other prior history of knee problems?
No.
Okay. What activity were you engaged in when you first noticed these symptoms?
I was running.
Okay. Did you hear or feel anything at the time of onset?
I heard a pop.
Okay. Were the symptoms sudden or gradual?
Pretty sudden.
Okay. And when do these symptoms typically occur again? So like morning, night, after you do something?
Usually after intense exercise.
Okay. And then have you taken any medication for it?
Just Tylenol.
Awesome. All right, and then as you were coming in here and sitting here as well, I've been taking some observations, just general, looking at certain things. And so first I was looking at like your gait when you're walking in, and I did notice you were avoiding a little bit of pain on that knee. So I like to call that antalgic. You have an antalgic gait. I didn't notice any hyperextension, any laxity. Your patella seemed normal, didn't seem medial lateral. There was no swelling, no real deformity that I've noticed, and also no redness, so looking pretty good there. And so I'm going to palpate a few things to get a better feel. So first I'm going to go with the medial joint line of your knee, and then we'll move on to the lateral. So you just let me know if there's any pain or anything like that. All good?
Yep.
Okay. Good?
Yep.
Awesome. And we'll go lateral. Any pain?
Nope.
Okay. Any pain?
Not at all.
Okay. And then we'll go down to the fibular head here, just on the side, and let me know if there's any pain here.
Nope.
No? Okay. Same thing over here. Any pain?
A little bit.
A little bit? Okay. And then we'll do the tibial tuberosity. This is where your patellar tendon connects down on your tibia. Just let me know if there's any pain. Okay. Any pain there?
A good bit.
A little bit? Okay.
Yeah.
And then finally, I'll just palpate your patella, see if there's any extra movement, any sudden deformities, anything like that. And you just let me know if it's painful at all.
Okay. No, so far.
Okay. Same thing over here. Good there. Okay. And then I'll have you do some active knee range of motion here. So it's just you moving around for me. So first, since you're already flexed, I'll have you do extension with both knees. Okay. Any pain with either of those? Okay. And then I'll have you go back out into extension for me, and then flex more for me. Let's see if any pain there.
A little bit.
Okay. Same thing on the other side. Any pain there?
No.
Okay. And I'm gonna also test some tibial internal and external rotation here. So I'm just gonna hold your leg in place here, and I'll hold here a little bit, and I'll just have you turn either your foot in or your foot out. And let me know if there's any pain or anything like that. So go ahead, turn your foot in. Okay. And turn it out. Okay, any pain?
No.
Okay. Same thing over here. Have you turn your foot in. Okay. And then turn your foot out. Okay. Awesome. And then I will do the, there's a valgus stress test, so on your knee, and it'll just be testing the integrity of your MCL.
Sure.
So, yeah, we'll have you roll it up a little further, and then I'll have you straighten out here. And then I'm gonna push in
Okay.
right here, and then pull with the other hand, and you just let me know if there's any pain or anything like that. So, doesn't seem to be any movement. Good. Okay. Do the same thing over here.
A little bit.
A little bit.
Yeah.
Okay. Awesome. Thank you.
Thank you.